Thank you, and welcome everyone to the City Club of Central Oregon. Today's live stream is Your Mind, Your Body, and the Pandemic. My name is Christine Coffin, and I'm Director of Communications with Oregon State University Cascades, and I'm honored to also serve on City Club's Program Committee, and I will be your moderator today. First, I'd like to thank City Club's annual sponsors. Without the support of these organizations, we wouldn't be able to bring you today's live streams, so please join me in recognizing them. City Club has been disrupted by the COVID-19 pandemic and its impact on public events. If you're watching this, please consider making a donation. If you've been toying with the idea of becoming a member, now would be a great time to sign up. Your support during this challenging time will help ensure that your City Club is ready to bring us back together when it's time in person for conversations of consequence that help our region thrive. To become a member, sponsor, or to donate, visit our website at cityclubco.org. Today's live stream would also not be possible without Hand in Hand Productions. City Club is proud to partner with Matt Hand as we venture into the digital world. Thanks so much for all you're doing for our community, Matt. We hope you enjoy today's program and learn some important facts and skills that enable you to cope during the COVID-19 pandemic. And in that spirit, we hope you are able to enjoy today's live stream with compassion and a sense of pioneering adventure. Viewers, you are invited to submit questions for our guests in the comment fields on YouTube or Facebook, and we'll get to as many as we can during Q&A. So let's get started. Our esteemed guests are also from Oregon State University, and they are the creators of an undergraduate course now underway called Punch Through Pandemics with Psychological Science. And the course helps students understand what it takes for the human mind and body to navigate this era of the pandemic successfully. And it has attracted not only 110 or so undergrad students, but also 3,500 community members from around Oregon. So Dr. Kathy Becker Blease is an associate professor and director of OSU's School of Psychological Science. She has a PhD in developmental psychology from the University of Oregon with an emphasis on how children react to trauma. It's a field called developmental traumatology. Dr. Regan Gurung is a professor of psychological science and director of OSU's general psychology program. He has won teaching awards, including the American Psychological Foundation's Award for a Distinguished Career in Teaching Psychology. And he's also the interim director of OSU's Center for Teaching and Learning. And he has a TED Talk called Get Psyched, Think Stronger, Live Longer, which is a pretty interesting watch. And Kate Gallagher is the coordinator of OSU's Contemplative Studies program, and she has a master's in applied religious ethics with emphases in Buddhist and yogic philosophies, psychology, and contemplative pedagogy. She's a yoga instructor, and interestingly, in 2018, she spent a year in a secluded solitary retreat to study and practice meditation full time. And we're going to be learning a little more about that later. So welcome to all of you, and thank you so much for being here.
Thanks for having
us. So let's start with Kathy. So take us back to February. The pandemic is it's not yet occurred. It's very much remote from us, and you're looking forward to getting over finals and spring break. So tell me what you were thinking at that time and how you were thinking around the course evolved.
Yeah, right. So I'm the director of the school. So I, put courses on the books and that kind of thing. And so we had these different levels, and I think these levels were kind of true around the world. There was levels 1, 2, 3, and 4. And level 1 was kind of like wash your hands. And level 4 was like fully remote, go home and teach from home. And we thought, we went from 1 to 2, and I distinctly remember a day, Regan running down the hall, level 4, we're going level 4. And it happened just that fast that we thought, wow, this is really going to rock people's worlds, and it's really going to rock students' worlds, and maybe we should think about how to respond. And it was pretty soon after that that we thought about this class.
So fast forward, and you have 3,700 plus students in the course and 3,500 community members. So what does that tell you?
Yeah, right. So the students are not only around Oregon, they're all around the world. There's an OSU student, I believe, from who's living in South Korea. And so as we were putting the course together, it was really clear, even within the US, that some of the things we were experiencing in Oregon were really quite different from other students in the class. And so it's been really interesting to empathize and think about different people's experiences who are ahead of us on the curve, or countries or areas that are approaching it differently. The students who contacted us or enjoying the class just were really interested in community, interested in what they could do, what they could learn. A really interesting wide age range. So I had teenagers who were out of school. At that time, school wasn't really happening yet. So we had teenagers who were in the class, and then we have all the way through people in their 80s who are at home and had interesting life experiences. So it said to us that there were people all around the world who were interested in sharing this experience with other people and learning in the process.
Mm-hmm.
Yeah, Christine, just to add something there, I think something that's been pretty neat is to see the reactions both from the people taking it, but also the need. And I know when Kathy and OSU put it out that this course was taking place, we got a lot of contact from pretty much every state out there, somebody or the other reaching out. And I think personally, what I find from a community standpoint, what's been the neatest is how folks in the community have been taking it. Just one anecdote that I think really brings this to life, with masks on, I was taking my son to school on the one day that they had to come in and quickly pick up all the contents of their lockers, right? After school had closed, they had been working at home for some time. And there was this one day where it was pretty clear they were not coming back for a long time. So they could all go in and pick up the stuff from their lockers. And I took him to school, and the way it worked is somebody came up to the car and they said, "What's your name?" And I will get your stuff. And as they were getting the stuff, somebody else came up, and I was almost ready to say, "Oh no, we're already being helped," when through her marks she said, "I'm in your course." And, and it was one of his teachers who was also taking the course. And it was the weirdest thing, whereas I was ready to say, "Are you one of his teachers?" And here she was saying, "Hey, you're my teacher." And we just got to be talking about the course. And I think right there, that really, here are the teachers working so hard to work on remote education for their students. And here she was talking about taking it so that she could help herself cope and maybe come up with things to help people cope as well. So I think that's just one anecdote, but there are a lot of those that I think have happened to us and occurred to us over the last few weeks. That's been really neat to see how the course, and I think the need for the course, resonates.
Yeah, I can add to that. I'm fielding the emails right now for the course, and I think the need is really evident in the emails that I get from people. Almost every day, I get an email that says, "This is a lifeline for me." I mean, just flat out is the sort of emails that I'm getting on a regular basis, that people are applying the tools and that they recognize it as just a resource that's in great need for them in their lives.
Yeah, Kate brings up the idea of stress, and I think we'll discuss the stress a little bit later. That's something I think we're all experiencing, no matter what our background is. So Regan, the course is divided into modules, and each module happens over a period of a week with in-depth learning, readings. Each module dives into a big topic like harnessing the mind, making sense of risk, coping. And when I look back at some of the early classes, some of the information that was shared, it is already outdated. And the guidelines around face coverings is is a really simple example. But you're teaching a subject that is happening at the same time. The subject matter is really evolving. So how do you make sense for your students of such an evolving subject?
So I think what's interesting here is, and starting with the title of the course, Punching Through the Pandemic with Psychological Science, the main idea here is that there are years, over 100 years of psychological science that can help us cope with this pandemic. And I think the neat thing is there are psychological theories that apply to a variety of stressors, right? A variety of pandemics. There are some basic ways that we respond as human beings. There are some basic coping strategies that we all have that are constant across the board. So you're absolutely right in that maybe something specific as how many feet you should stay away from somebody, or how far can those particles of COVID travel. That may vary. We may be finding out more about how long it stays alive on cardboard, for example. But when it comes to psychological stress, that's a constant. And I think one of the things like stress, each of us vary in how we deal with it. And I think as something that Kathy alluded to earlier, is there's a lot of research being done very quickly to try and find out the specifics of this kind of stress and the specifics of this kind of stressor. But there are so many commonalities with this as a stressor. So we can use the word pandemic, or even better, use the word stressor. And when we look at it as a stressor, there are enough commonalities here that we have a very hefty, reliable base of psychological science to tell us how to cope with. So that said, the three of us are constantly vigilant for new information, and in a very metacognitive kind of way. One of the big things that we talk to our students about and share on the site is actually how to be sensitive to research and advice out there, because advice is changing so quickly. So I can actually remember one of the weeks, I think it was a couple of weeks ago, where we spent some time on how to look at research and how to not spend too much attention on research that may have been the only study. Wait for replication, wait for something to be actually published. So that's how we're taking care of that, where we're making sure that the theoretical bases are the solid foundations of psychological science that can help out, but we're also being very open to what's changing. And I will say, Christine, directly to your point, we did have one of our very, very early postings. This was before we had too much that was pandemic related. And one of our very, very early postings was a podcast, if I remember correctly, that was pitched at some assumptions about the pandemic that were actually quickly found to be not right. And we immediately went in and edited what we had posted and actually put in a little note about that. And it's only been one event in all the material that we've had where we directly had to go back and say, this is no longer standing. So we're really paying some very close attention to, making sure that we are being good consumers of science and getting out there what has a solid basis. But that's a great point, and I think all of us and all listeners should be watching out for, is before you jump on something that you hear, really take a good look at who's saying it, and, what the evidence is before you take it and pay too much attention to it.
Yeah, so the forest stays the same, the trees just are a little different. So along those same lines, one of your early assignments, and in the interest of full disclosure, I'm a student in your class, not one of the better ones, but it was a podcast, and the host was observing the lockdown in Wuhan and surmising with the guest that a lockdown would never happen in the US. That's just not a concept we use here. Well, it happened and, surprised all of us. So I think this question is to all of you. How are we doing?
Yeah, boy, I wish we had our expert on history or maybe political science here. Part of what I've heard is that a lockdown can happen in a democracy, but it requires more open communication and trust. And so the democracies that have made it work have some trust in their leaders. And so I think I've been thinking about that a lot, and how we have the lockdown is working in terms of fear. So people are fearful to go out, and I think that's keeping people home. But the concern is that we're losing trust in the leadership, and then that could be a real problem in a democracy like ours. But I don't know if I have any particular psychological expertise, so I'll pass it to Regan to see what he can think up, and then maybe to Kate.
I think when you said how we doing, there are so many levels that I took that at.
I should have clarified. I mean, were we well equipped for it? And what qualities are we lacking as individuals to cope with it?
Yes.
And we won't have to cope with it again, by the way.
Right.
But,
So I think one of the biggest things for us to watch out for, and in the psychological answer to your question, is how we do with with a lockdown or any stressor really depends on some key dimensions. So, for example, the predictability of something is important. How much control we have is important, and I think the duration is important. And I think what happened here with the lockdown is that really early on, so Christine, like the guest that you were alluding to, I think Americans had a very different sense of the extent to which it would be a problem for us. And I think because as a country, we didn't do enough to anticipate what it would look like. I think very early on, we had a lot of that. It can't happen to us, that sense of invulnerability, that sense of, we don't have to start planning for this. Immediately, because of that lack of predictability, I think we didn't get out of the gates fast enough. I think we've made some great gains recently once everything locked down. But I think even right now, when you take a look at the variance in states in how they are staying locked down or opening up, I think right there, it's very confusing for some individuals to look at what's going on. And I think Kathy's point about leadership is key, because how can you the science is the science, the facts are the facts, the science is the science. How can there be so many different interpretations of the science to lead some states to open earlier and some states to not? For the average person, that's confusing. For the average person, that's confusing. For most of us, that's confusing. I think, for many of us, especially the three of us, where we're looking at the science is pretty clear. The science is pretty clear. We don't have a vaccine. You open it up, well, it's not like you can go back to the beach and now things are different. No, it's exactly how it is, 3 weeks ago. We talk a lot about flattening the curve, but we forget about the fact that area under the curve, the number of people who would get sick, that's still pretty constant. It's just when that'll happen if we don't stay secluded. So, going back to that, how are we doing? I think because of the lack of preparation and the unpredictability of how the lockdown was sprung on many of us, you see so much of that variance. And I think we didn't do a good enough job as a country in sharing the reasons behind why a lockdown is important. And even right now, when we see a lot of protesting, the rhetoric I see in the protesting, there's a very psychological explanation to that too, where you can see why is it that some people are protesting and what are they saying. Automatically, we can see that we haven't done a good enough job for rationalizing why that physical distancing is important in those physiological terms of virus spreading. And I think we can. Some states are doing a really good job. I think Oregon, thankfully, is doing a wonderful job, as far as I can tell, in comparison to a lot of other states. But I want to go back to what Kathy said. It's leadership, and we're having inconsistent leadership across the states, and of course, quite the mixed bag of messages coming from the federal government.
Yeah, thank you. And Kathy, piggybacking on that, you mentioned the fear that the people are staying home because they fear the virus, but the people Regan mentioned who are protesting, they have a greater fear of other things in their lives, which is causing them to protest and want to leave home and go back to work. And can you explain a little about that?
Yeah, well, I think this is an area of new research where psychologists are attempting to apply some of what's been known in the past to this particular issue. And so there was some new research that's come out that's trying to understand the motivation. So I think what psychologists are trying to do is first describe and understand where folks are coming from, and then put into place intervention, different ways, different messaging, different framing that will lead us to a better outcome. And so some of that research that's just coming out with all the caveats Regan said about peer review and that kind of thing is showing there's some people who are more fearful of getting the virus, of getting sick, or maybe spreading it to others who are vulnerable. And that's driving people to stay home. And man, are we seeing that, I'll just say, among faculty and parents when we talk about reopening schools. It doesn't really matter right now. I don't think if we opened up tomorrow, very few people are ready to send their kids back to school, and very few faculty are ready to go back to the classrooms because of the fear. So in that sense, it's helping us. But there's another group of people, maybe in counties where there haven't been as many cases, or for other reasons are less fearful about actually contracting the virus or spreading it, but they're very concerned about losing our freedom and our liberty and our way of life and values that we hold really dear. And so some of the research is just showing that you can get to one outcome or the other, but it's the same kind of psychological mechanism at root. It's what's the bigger fear for you at that point of time. It's not the only way to conceptualize it, but it's a really good example of how psychologists sitting at home with their Zoom and their laptops are trying to generate new research right now that would be helpful right now.
And I imagine some of the motivation for wanting to break the stay-home orders are around economic need. That some families simply need to go back to work now, and there are lots of competing issues. So you had mentioned that the different groups in society who are kind of experiencing the pandemic through different lenses. And we've all seen the news stories of how the virus is hitting some segments harder. For example, Black and Latino families and communities, or frontline service workers who are often from underserved backgrounds. And one of the topics you talk about in the class is how culture and diversity bring differences to coping mechanisms and very different stressors too. So how do culture and identity play a role in coping with the stress that a pandemic brings?
So let me take a shot at that. I think there are two main issues here. The first issue is that, unfortunately, there are disproportionate who's doing different types of jobs, that it's disproportionate across racial groups and ethnic groups and social class groups. And I'll give you a simple example. If you took a look at there was a great map in the New York Times recently about which are the 10 areas where, there are the biggest issues. And one of the areas on that map of 10 caught my eye because it was Green Bay, Wisconsin. And I had spent 20 years in Green Bay, Wisconsin before moving here to Oregon. And Green Bay, Wisconsin was number 5 on the nation's top 10 areas of problems with cases and number of cases per day and so on and so forth. And living in Green Bay, Wisconsin, and then checking to see why, a big part of the issue is that Green Bay, Wisconsin, there are 2 big industries in Green Bay, Wisconsin. One is meatpacking, and hence the Green Bay Packers. It comes from meatpacking, and the other is paper. And in the meatpacking industry, it's a very high risk job. The hours are horrible. I actually got some stats for the meatpacking industry in Green Bay. And some years ago, when I looked at the numbers, here's what it was. At one particular packing company, out of 1,500 employees, 1,474 were Latino. That is pretty staggering, a disproportionate, sense of who's working and doing what. That's, I think, one part of your answer to your question is why is it influencing some groups or the other? Mm-hmm. The other part is actually different cultural groups. And actually just yesterday in class, we had a wonderful discussion about culture and coping. And I think Kate can say more about that in a second. But the other angle with culture is that what we see, and here when we take culture broadly defined, different religious groups, different ethnicities, genders, sexual orientation, so on and so forth, different cultural groups actually have different dynamics in terms of the provision of social support, the receipt of social support, how normative it is for families to meet together, for networks and so on and so forth. So there's this really neat balancing out of, on one hand, cultural differences put some individuals from cultural groups at more risk, my meatpacking example, right? And on the other hand, being from a certain group can give you some advantages that other cultures don't have. And I think it's that balancing act between which of those two is more at, playing the part. Some of those positives are offsetting some of the negatives, but I think unfortunately, going back directly to the statistics that you mentioned, for the most part, I think coping and the stress levels are disproportionately affecting certain cultural groups for sure. Mm-hmm. And we can, unpack that a little bit more as needed later. But I think you're absolutely right. And some of that is who's doing which jobs and where. It's not equal across the board.
Yeah. And Kate, in the class, you focus a lot on the mindful practices, how the simplicity of being aware of the present can really help you bring back control and really help calm you and enable you to make better decisions. I'm wondering if those groups that we mentioned and Regan just talked about, are those mindful practices accessible to them too, and do they welcome them? I know that I could be wrong, but when I think about yoga and mindfulness, that sometimes that's reserved for more privileged groups, but they are effective and proven to be effective.
Mm-hmm. Yeah. Something that we have tried to emphasize throughout this course is that when it comes to the tools and techniques that we're offering, is that they're just different strokes for different folks, not only because of their cultural background, but for any number of reasons. Their religious background, their ability, physical ability, as you mentioned, accessibility will play a role in, whether a coping strategy or tool or technique will be useful. Do they have access to teachers or to recordings or that sort of thing? Also, what sort of proclivities people have for sitting still versus, I don't know, going for a jog or something like that. So we've really tried to emphasize throughout the course that we're offering really a variety of tools and techniques, and we've suggested that people just kind of try them on and see how they work, collect the data from their own personal experience, and then determine whether it's something that will be useful to them ongoing. And so, there's a lot of free information, mindfulness recordings, on the web. I mean, there really are a lot of resources now. Whether a person, knows where to look is another story. We certainly have tried to provide a lot of resources in our course. But, I think, our goal is to share variety and for people to try things on, put things down, and go from there. And, I guess I think one last thing I'll say about this is that there are traditions of this nature. There are practices of this nature in every culture. Although yoga and meditation might be associated with India and Tibet and Eastern philosophies, there are mindfulness practices in Christianity, centering prayer. There are practices of this nature in all sorts of different traditions and cultures. And I think the hope that we have is that we encourage people to discover or rediscover those in their own cultures, or in their own traditions, or in their lives, however they might experience it. Just going out in nature, which is something that hopefully we all have access to in one way or another, although the amount of nature we might have might be quite small, just in a house plant or something like that, if we're not able to go outside. So I do think access is an issue. And I think there are ways around that, including being very creative with how we think about contemplative practices, and not thinking that they have to look any certain way. And so spreading the word, I think, is what we're trying to do to increase accessibility.
Yeah. So I'm curious, your year-long solitary retreat, which was just 2 years ago, was that the perfect preparation for the stay-home orders?
I suppose so. I kind of think of it as the perfect preparation for the rest of my life. Speaking of privilege, being able to do that was a humongous privilege, and one that I recognize readily. I had so many people support me in doing that, and had a lot of luck and good fortune to do something like that. And, while we can all probably sense the profound uncertainty that we all face right now, and the vulnerability that always exists, but is now at the surface. I really think of my time in retreat as a sort of foundation for encountering whatever sort of peaks and valleys I might experience in my life, and this being one of them. Meditation and stabilizing the attention through mindfulness and through meditation confers a whole set of inner resources to meet the demands of life. And so I do think it was a good preparation for this. It's funny, when I was in for about 6 months, I sort of thought about extending my retreat for another year or two, and to do a little more of a traditional 3-year retreat. And now that we're all alone anyway, I'm kind of like, maybe I should have done that, but I don't think it would have worked out. And I'm so glad actually to be part of this team and really to be connecting with people in this way. So I'm glad to not be in retreat actually right now.
Yeah, I think we're glad too. The course is obviously having tremendous impact with so many people. So Kathy, I'm wondering, your field is in the experience of trauma in childhood. Mm-hmm. And do you think there's any aspect of this of this lockdown that is impacting children now? Do you think as they become adults, some of them might look back on this time and think of it as a trauma? And how can parents help to mitigate that?
Yeah, I do think about this because I'm here at home with 3 kids. They're 6, 13, and 17, so quite a range, and hopefully not, don't want any of them to be traumatized. And so some of this we know. So trauma really is a response that humans have that exceeds our normal stress response. And so most of what Regan and Kate have been describing are within the normal range of stress response. So there's, activation, and then trying to kind of get calm and get centered and mobilize resources and move forward. So mostly what we're seeing, while a serious stressor is really within the normal realm of humans to cope, to cope with. But there has been some work in the SARS quarantine with some children that showed that when kids were quarantined, in the same way we are now, where it's against our will, really. I mean, there's a governor's order. That there were kids who had symptoms of post-traumatic stress disorder, which does kind of kick you over into something beyond normal range of stress. And so that has been a concern from the beginning once we moved to the non-optional kind of quarantine that we're in. I think I think it's interesting when you think about how our kids are going to think back on this. I think of my own grandparents who lived through the Depression, and many of us who knew people who lived through the Depression, they did things very, they were very impacted by that. So they would save, like, remember saving the inside of the cereal liner, to because you never know if you'd ran out of saran wrap and things like that. But we don't have people who describe the 1918 flu pandemic that way. Like, we barely recall there was a flu pandemic, So I kind of think that maybe our kids won't be hoarding, washing their hands compulsively when they're 100, the way that my grandparents were compulsively hoarding things when they was the Great Depression. Generally, the group from my own research that I think a lot about are the young teenagers. So it turns out younger kids, we do a pretty good job kind of shielding them from a lot of coverage, and we don't expose them to that. Teenagers, we talk to them a lot because they're old enough. I have a 17-year-old. I have to explain to her why she can't drive. So we talk about it. It's the 11 to 13-year-olds pick up a lot through their friends. It used to be through the phone or something, but now I swear it's through Discord or wherever they are playing their games and stuff. They hear the rumors, but they don't have the context for it, and we don't engage that age group in the same way typically, because they're busy doing other things. And so the research we showed in the past around media exposure and scary things said those kids were the most worried, and it was not dependent on how much media they saw. And that's because the rumors would get going amongst themselves without adults kind of feeding them in. So I think a lot about those middle schoolers and what are they able to understand, and what are they worried about. So that's the group I worry about. But trauma, certainly we worry about the medical workers who are having to make life and death decisions. That's clearly that group is experiencing clear trauma. There's clear problems there. But for kids, I think we're really talking about helping them in the normal range of coping with stress.
Mm-hmm.
Yeah.
Well, that's relieving. And you mentioned news. So one of your classes talked about a study of individuals who watched news, I gather, obsessively around 9/11, and how years later that group was found to have long-term negative health impacts. And I was one of the people who was just consumed with the news in the early days of the pandemic and have weaned myself a little bit. But can you, news coverage, and how it brings stress, what do you advise people to do when we're watching this incredible story unfold in front of us, and some of us simply can't take ourselves away from the news, but at the same time it can be harmful?
Yeah, so I'll just comment on what we know from media exposure in the kids, and that's that we know that adults need to be really careful about how much news they consume, because independent of how much kids see this stuff, there's clear evidence after 9/11 that parents' own anxiety around their own news was translated to the kids. So I'm pretty mindful about whether the news I'm watching is causing me to be more stressed, not sleep, or become more irritable, because there's nothing productive about that. At the same time, I live with a family member who's higher risk, and the data is very, very important to me. Every study that comes out from every location is actual information that I find valuable. So I tried to take the advice of one of our guests who really asked us to focus on what's the outcome. Is this helping you move forward, or is it just causing more worry? And if it is worry that's productive, that we're living in a lot of, some of this is legitimate, a human response to an actual stressor. So if I'm living in that realm, I'm okay with it. If it's just keeping me up at night and I'm not really moving forward and I'm getting more irritable with my kids and I'm not sleeping well, then I try to take a step back. Regan.
Yeah, I think there's a really interesting additional thing here, and Christine, this goes back to, general theories in psychological science and what we know. A lot of my training is in health psychology, and one of the variables and measures that we look at in health psychology as far as individual differences go is something actually called need for information. And the neat thing about the need for information scale is that there are some of us who actually want and need information, and some of us don't. Those of us who have a high need for information, actually not having information can be a stressor. And I think that's a really important thing for us to keep in mind is there are going to be some people who want and need to watch the news a lot, and there are others who really don't care, or would do better without it. And I think that's just a really neat individual difference that I know I've been thinking about these days in terms of how much news to get.
Well, that's an interesting point. So we've started to get some questions from our viewers, and one of them is, we'll start with Kate for this one. Dan Harris of Good Morning America talked about the 5 things he does every morning for his mental health. What are the top things each speaker practices on a daily basis?
So the question is, what are the few things I do on a daily basis?
Yeah.
Okay.
Yeah. And however often you do them. Yeah.
Yeah, sure. Okay. Well, I meditate every day. If I'm really, really stressed or kind of, in the midst of a little more in the crisis mode, I actually don't meditate, but I do relaxation practices instead, which are slightly different. And we don't need to get into the differences between them, but relaxation is all about just laying yourself out, breathing deeply, and calming the nervous system. Meditation requires a little more discipline and focus. So I either do relaxation or meditation or both each day. I definitely move my body, walking, running, hiking, yoga. So some sort of embodiment practice. And let's see, I don't know, those are my go-to. And then, kind of, I think a third thing that I do is I moderate my technology intake, which has always been important to me, but is especially important to me right now because it's where I do everything. And I really notice the fatigue that I get from it. And also how just constant emailing, constant checking, constant responding, whatever it is, increases like my personal anxiety. So a third thing I would do is I kind of try to take time to be offline and, take a bath, take a shower, and wind down.
Yeah, those are great. I like the embodiment practice. I'm going to focus more on those. So Regan, what are your, the top tips that you recommend for mental health? So,
I'll tell you what I do. There are 3 main things that I do. One is make sure I walk in trees every day. And it's just the entire family, we take a walk every day through some trees, and we have some around. I make sure that every day I read some fiction. And that's pretty key because so much of our work is reading science and journals, which I do love, but I make sure that the last thing I do every night is read some fiction, old school, on paper. So we read some on paper. Thing is, and this gets to your point in a way, but every day in our household, we make sure that there is a good block of time when all 4 of us, it's my wife and I and 2 kids, all 4 of us are together without any technology. So we do that every day, and that's been helping.
And Kathy, how about you? What are your top recommended tips for mental health?
Yeah, I also get outside every day. I think we're all so lucky here in Oregon, and it's so important to all of us. Many people live in Oregon, so I do try to get outside every day. I try to eat dinner with our, family. We try to be in the same room and eat a meal together. And our kids outnumber us. I don't know that it would go well in a room with no technology, given the age ranges, but my husband and I try to connect. I just try to laugh actually with my kids every day, even if it's laughing watching a movie. I'm okay with that. I'll watch a Disney movie or whatever because we're tired or whatever. So I think that we call it shared positive affect. So try to have shared positive affect with each of my kids. And then my husband and I we go to the grocery store together. That's our main time to like be alone. And so we try to have time together too. But I guess the take home is for all of us, take time to be outside, take time to move our bodies, and then pay attention to relationships. And I think we come back to those in the course over and over and again, even though our lives look really different.
Yeah.
Yeah.
So we're,
I think,
oh, sorry, go ahead,
sorry.
Kate.
I was just going to say one of my biggest takeaways from the course, we've had so many wonderful guest speakers, and we had a nature psychologist who just so has helped me change a pattern of mine. And I want to add to my list. I want to steal from Kathy and Regan and say getting out in trees, like trying to get out in 360 nature, which we are very lucky here in Corvallis to be able to do that. But Georgina, the nature psychologist, she just spoke about how and relayed the restorative benefits, the cognitive restoration that we get from being in nature. And that has been a lifeline. And so ever since COVID hit, I've been trying to get out to Chip Ross Park every day because it makes a huge difference.
Yeah, well, thank you, all of you, for those. And time is running out shortly, so we have time for probably just one more question and then have to wrap up. And so the question is it too late to sign up for the course? Will it be offered again?
So I'll take that. So the course, it exists online on a website, and we did that on purpose so that it could be accessible to people in the future. And I don't think we have plans to take it down unless it gets so out of date that we get, it doesn't become appropriate. There is an ongoing question of whether there will be a part 2. So we know that emerging from this kind of intense lockdown situation is not going to be easy and will have its own kind of set of challenges. And so we don't know yet, but certainly people have wondered, is there like a phase 2? And I kind of feel like we're entering into a phase 2, but the course will exist there, and the Canvas course too will exist. The Canvas course is more where there's discussions and things like that. That's more interactive. Both of those will exist for a long time on the web.
Thank you. And what we'll do is share that URL with viewers. And what you mentioned about the different stressors that emerge as we're reopening, that will be interesting to watch too. And so I think at 2:58, we probably need to wrap up. So thank you so much, Kathy, Becker, Blease, Regan, Gurung, and Kate Gallagher from OSU's College of Liberal Arts. Our City Club's next live stream is our annual Regional Managers Forum. You'll hear from city managers of Bend, Redmond, La Pine, Sisters, Madras, and Prineville on how their cities are dealing with socioeconomic impact of COVID-19. Tammy Bainey, Executive Director of COIC, will be moderating this fascinating discussion. So please tune in at 2 p.m. on Wednesday, May 27th. Please note, starting in June, our live stream programs will move to noon on the first and third Thursday of each month. We hope that you will continue to watch and be engaged. And remember, please consider becoming a member or sponsor or making a donation to City Club at cityclubco.org. Thank you so much for watching, and thank you to Regan and Kathy and Kate for joining us. That was fascinating, and thank you for offering the course too. Please, everyone, continue to cultivate conversation about issues that connect us all to build a strong community. Good afternoon, everyone.
Take care.
Thank you.
Thanks, everyone.